which is the most common type of headache, which is the only headache which is most of the times present bilaterally. What is the concept of central sensitization in the occurrence of headaches? So we'll try to learn about these questions in this current video. So नमस्कार, मैं डॉक्टर संजोग मेकेवार. I am interventional spine and pain physician and also the director of Jeevisha Spine Pain and Regenerative Hospital. So आज हम बात करने वाले हैं the most common type of headache, that is tension type headache. तो tension type headache में पहली चीज जो हम बात करेंगे वो है पैथोफिजियोलॉजी. ये होता क्यों है, राइट? सो जैसे कि बाकी प्राइमरी हेडेक्स में ट्रिगर्स होते हैं, द टेंशन टाइप हेडेक में भी देयर आर प्रेजेंस ऑफ सम ट्रिगर्स. एंड व्हाट आर दीज ट्रिगर्स? These triggers are dehydration. Okay, so if there is a lot of vomiting, there is fever, or there is any other excess activity because of which there is loss of water from body, there is dehydration, it can act as the trigger. There is any kind of stress or there is sleep deprivation, or there is some kind of muscle tightness which is present around your neck or the head. So these are all the triggers because of which there is paramedian or paraspinal muscle tightness. So जब ये मसल्स जो हमारे स्पाइन के आसपास में प्रेजेंट है उसमें टाइटनेस आ जाती है, वहां जो ब्लड वेसल्स रहते हैं दे स्टार्ट कंप्रेसिंग and there is a bit of inflammation which occurs around those blood vessels. We know that the nerve which basically supplies all the structures of the face and the head is mainly the trigeminal nerve. So जो blood vessels के पास में जो nerve terminals हैं, they are activated because of this inflammation, and these nerve terminals are of trigeminal nerve, that is the cranial nerve 5. Now this will basically sense it as the nociceptive pain, and it will send signals towards the thalamus, and from where it is relayed to the sensory cortex of the brain. और यहाँ जाने के बाद हमें जो एहसास होता है वो एहसास होता है एक हेडेक का. So this is basically the pathophysiology of your tension type headache. So in the patients of tension type headache, the headache is present bilaterally. It is present mostly in your frontal and temporal areas. जो headache का character होता है वो patients complain करते हैं कि there is something tight band which is present around the forehead. Then एक बार headache चालू होता है, then it may last for around 4 to 6 hours. There is no nausea, vomiting. There is no photophobia, phonophobia. That is, the intensity is not increased with the sound or the light. But अगर ये tension type headache chronic हो जाता है, मतलब एक महीने में 15 दिन से ज्यादा अगर ये headache रहता है, then there is something called as central sensitization which happens. And what is the central sensitization? Because of the continuous stimulation of these nociceptors of the trigeminal nerve, there is increased sensitivity of the nerves at the central level, and because of which the intensity of pain which the patient may be feeling like out of 10 there is the intensity is 5, the intensity increased to 8 to 9 out of 10. So this is the basic concept of central sensitization. And when the central sensitization happens, patient may complain of some abnormal symptoms like photophobia, phonophobia, or some abnormal sensations like paresthesias around the face, head and neck. अब हम आते हैं टेंशन टाइप हेडेक की ट्रीटमेंट की तरफ. तो लाइक जैसे कि मैंने बताया था क्लिनिकल फीचर्स में, देयर कैन बी अ एपिसोडिक टेंशन टाइप हेडेक, दैट इज अभी हेडेक का अटैक है, एंड देयर इज समथिंग कॉल्ड एज क्रोनिक हेडेक. सो फॉर episodic headache, the drugs that are given for its treatment are mainly basic painkillers like your non-steroidal anti-inflammatory drugs, or as basic as paracetamol. We can also combine muscle relaxants along with non-steroidal anti-inflammatory drugs for the treatment of these headaches, because these patients have a tendency to have muscle tightness or muscle spasms. Now, coming to the treatment of the chronic headache. Now, the only FDA approved drug for the treatment of chronic tension type headache is your tricyclic antidepressant, that is amitriptyline. It acts very beautifully in these patients, and the patients get relief from these tension type headaches within a few days. If suppose the patient is not responding to this amitriptyline, then we can try other antidepressants like venlafaxine. Now, beyond these basic antidepressants, non-steroidal and anti-inflammatory drugs, we can use something called as cognitive behavioral therapy. So the role of cognitive behavioral therapy is most important in tension type headaches when we are talking about all the primary headaches. Along with the CBT, the physiotherapy works wonders in these kind of patients. And basically, we have to do multimodal management for effective management of this kind of headache. Now coming to the role of interventional pain physician in treatment of tension type headache. So beyond these other conservative or basic treatments which are already available, interventional pain physician can do what is called as Botox treatment, which includes the injection of small doses of botulinum toxin inside the muscles which are in chronic spasm. And once the spasm is released, the intensity of this tension type headache is released. There are other things that can be done like dry needling, neuromodulation, nerve blocks, which have shown some promise in the treatment of tension type headaches. So दोस्तों, आशा करता हूं कि इस वीडियो में आपको टेंशन टाइप हेडेक रिलेटेड जो भी इंफॉर्मेशन है वो मिल गई होगी। अगर आप ऐसे ही वीडियो देखना चाहते हैं देन हमारे कमेंट सेक्शन में आप लिख के भेज सकते हैं। आप इसी तरीके से हमें प्रोत्साहित करते रहिए ताकि हम और ज्यादा इंफॉर्मेटिव वीडियो के साथ आते रहें। धन्यवाद।